For my career research interview, I interviewed a nurse named Emily who went to school for her BSN and is currently working as a nurse manager. The first question that I asked her is what she loved about her job, and she responded with by saying that she loved helping those in need and feeling like that she had made a difference not only in the lives of her patients but in the lives of their families as well. I asked her next what she least liked about her job, and she said that death is not an easy part of your job, but when working with sick people, it's just kind of something that you do experience. She said she just tried to help the family stay as comfortable as possible and help them with whatever they needed. I asked her if there was any advice that she wished someone would have given her when she was in college, and she said most likely she would say not to take out as many student loans as she did. She said she was able to pay them off pretty quick because of the workforce programs and the forgiveness programs that are out there. But she said she wished that she would have worked somewhere that would have helped with degree assistance or tuition assistance so that she wouldn't have had quite as many loans after graduation. I asked her what a typical day looked like for her, and she said she works 12-hour shifts in the hospital. She said with that being the case, that's 36 hours a week is considered full-time, so it's only 3 shifts a week. She said basically she gives medication, takes care of her patients, follows any doctor's orders. She said she's the nurse manager on a cardiology floor, so basically working in any hospital makes for an interesting day, but especially working with cardiology patients, you always have to look for a code. And she said usually she's taking care of patients that either go into or are coming out of surgery, or that's what she was doing as a floor nurse. I asked her next what I could do now to prepare for my future career in this industry. And she responded with working in a hospital early on as a tech or anything like that is really helpful, because as a tech, you're literally a nurse's assistant. So you're watching every day, day to day, what you'll be doing as a nurse, and you see a lot more than you would just going through your clinical rotation, especially if you're working for a couple of years before you have your degree, because you actually get that one-on-one experience with the nurse, seeing what they're doing and with the patient as well. So you're you're experiencing a lot of things that you wouldn't catch just in the small amount of time you're in clinicals. I asked her next if she could work in any department or other than cardiology, what would it be and why? And she responded the emergency room. She said because you get such a variety of patients and cases, and since the medical field is really such a field of hands-on learning, she thought that it would help as a nurse to be able to see so many different cases like they do in that department. She said the body works together, and so if you're seeing just cardiology or just, you're used to one thing, sometimes it's nice to get a variety, because you can see the way that one disease or something like that could affect another. For instance, if you came in and you had just had a heart attack and you were diabetic, they may give you different medications than if you came in and you had a heart attack and you weren't, obviously because of your blood sugar. So to be able to see the different aspects of it would be neat. I asked her next about how long it took her to finish her degree, and she said it was a BSN, so it's a Bachelor's in Science of Nursing, so it was 4 years. The next question I asked her is if it was uncomfortable to do certain things at first whenever treating a patient, and she responded by saying yes, that whenever you have to do something at first, like draw blood, put in an IV, or put in a catheter, it all makes the patient uncomfortable and it can cause pain. So whenever you have to do something to your patient that causes them pain or discomfort, you kind of have to think about why you're doing it and understand that really has to be done. That's the only way it's going to make the patient better. For example, if you have a patient that is NPO or can't have anything to eat or drink by mouth, it'd be the only way that they could actually get their medication. Final question that I asked her was about how much she made and how much that she made whenever she first started off, and she is a floor manager now, so she said she makes about $96,000 a year. Whenever she started off with her BSN, you make a little bit more than whenever you just have an RN, so she made about $65,000. I'm very excited to go into this career, and I was very excited to interview her, and I appreciate her for participating in this.